physician-assisted suicide, on legalizing it. Wondering what your position on that is.
No, mostly because I think that would go against the doctor's Hippocratic oath on not trying to do what's best for the patient.
Right.
I don't think anyone who's really considering suicide would be in their right mind and would be able to make choices like that for themselves. And I don't think putting that choice in a doctor's hands is right. So
That's actually some really good points. The thing about the Hippocratic Oath is that it's something that's been modified many times over the years. Some things that have been modified are such as, that have been taken out, is women should not be allowed to study medicine, or even doctors should not be allowed to break the skin. So this is something that's ever evolving. So
and I think
it can't be changed.
I think it should, and if it's something that society as a whole thinks would be a good idea, I wouldn't be against it. I wouldn't like try and change it or try and stop it, but I don't like personally. I think that it would go against like the spirit of it. Even though like women not being allowed to be a part of it at the beginning, I think society as a whole is always changing. So it evolves to meet society's needs, and I don't think it should evolve into that.
All right.
So.
Now, you said that the person, when they're terminally ill, isn't really in their right mind. They're depressed and such. But there's also people that say like it's their body, it's their choice. They're aware of their own emotions and their physical pain, and that sort of thing. It sort of like goes with the abortion sort of side, their body, their choice.
That gets into a little tricky stuff. They are technically correct. However, I know quite a few people who are either in depression or getting out of it, or who are alcoholics who really don't know what's best for them. Who believe that, all right, if I keep drinking, my life will get better magically. So it's different, and I think at some point it is true. I think the abortion argument is mostly correct. As far as assisted suicide, I think that's kind of where a line is drawn, where it's like, all right, you're either a moron and want to die for no reason, or you feel like you can't live anymore and you need help, and I can't give you that help. So you have to, I don't know. I think it's an interesting topic.
Well, remember when for assisted suicide, they actually have to get diagnosed that they're mentally stable, and the doctor has to give an okay.
That would be interesting. I think it would have to be done by a doctor that wasn't going to commit it or get paid for it, because I think that would skew their interest a little bit. But that could persuade me, yeah.
Well, thank you, Chris, for the interview. That was really great, man.
Yeah, thanks, man.
Thank you. I don't know. I feel like you should have families consent at least. That's hard.
So you don't think it's the individual's choice? It's because the individual is going through that?
I don't think it's the individual's choice. I mean,
it's the individual that's going through that pain, mental anguish.
Oh, this is hard.
If you don't
Okay, maybe yes, it is the individual's choice.
No.
They don't have to be forced to suffer.
Right.
So I guess if it takes them out of their misery, then that's the individual's choice.
So one thing about terminally ill patients is that depression sets in with a lot of them. And one thing that happens with depression is the wish to end their life. That's actually a symptom of depression. And a lot of these people that go to Oregon or these places where it is legal, they go undiagnosed. They are not evaluated for their mental stability, yet they still get prescribed a lethal dose. So they're depressed. It could be the depression that's making them want to commit suicide. And once they're given antidepressants, they change their mind.
Oh. So what are they?
So that's the thing. Like, what's your opinion on that? Should it be their choice? Because sometimes they go undiagnosed, and it's really the depression that's making them want to commit suicide. And once they get better, they don't want to end their life.
Okay, since you said that, since once they get better, they don't want to do that anymore. I don't think it should be the individual's choice.
It should not be
It should not be the individual's choice. Yeah.
because
They may be under a different state of mind, like you said, depressed.
should that be an option that's available to them?
No, I don't think without someone else's consent. I don't think so.
You know, many people commit suicide on their own because they're suffering and they're in pain.
Yeah, but that affects the families and friends and you know.
But since they're going to go through that, sometimes it's a botched attempted suicide, and they end up maiming themselves, and it doesn't go the way as planned. So they just hurt themselves more. Don't you think it'd be better if it's under the watch of a physician?
What do you want me to say?
No, I'm just asking your opinion.
Under the watch of a physician of
Like-
someone killing themselves.
This would be a quick, sort of painless, peaceful way to go instead of maybe just like something crazy and dramatic that could hurt other people.
I've said like both the answers. Can I be like undecided?
That absolutely works.
Yes.
Okay, I'm
Hey,
undecided.
thank you for your time.
Sorry for
Appreciate the topic that we're pulling on is the issue of legalizing physician-assisted suicide. Was wondering what your stance is on that.
Legalizing what?
Physician-assisted suicide.
Instead of assisting suicide?
Yeah, so it's when a terminally ill patient is given 6 months or less to live, and they go and get a diagnosis, they get an okay. The doctor will prescribe a lethal dose. Yeah, then the patient themselves has to be capable of physically taking the medicine to die.
What do I think about that?
What's your stance on that?
My stance on that, well, I think it really depends on the individual. But then again, I don't stand for it because you never know what can happen. You know, there's been cases where someone's diagnosed to die and somehow like they still live, you know. So my stand would be against that just for that same reason. But then again, it's the individual's right, you know. It's their whatever they want.
Okay.
But I don't think it should be the doctors like say.
So it's not an option that the doctor offers the patient. This is something that the patient would have to, at least in Oregon, something that the patient would have to voluntarily ask for, and then the doctor will send them somewhere, and they will be they have to be mentally evaluated, and then they're going to be okay.
That's what I was. Because especially, I mean, is that what you're trying to say? That that's the case?
Well, that's at least in Oregon and Washington. Those are the requirements.
It's tough. It's kind of tough topic. I'm pro-life, so I wouldn't go for that. You know, that's my opinion. Even if that person is like choosing to, you know, like I feel like they can get other people to like you said, like family, because it can also affect family, not just the individual. You know, so like my stand on that would be against that being legalized.
So what about, so it does affect the family, but what about like the mental anguish that the family goes through when they're watching their loved ones rapidly deteriorate? You know, they become incontinent, like they go to the bathroom on themselves, they just are quickly withering and dying.
I don't know. I think the families at that point they wouldn't mind helping out the individual. You know, like they wouldn't mind having this extra time with that person, even if that's like something they're doing and they're struggling. I don't think they would mind like spending those extra hours and days with that person, even if it's like that sort of circumstance. I would think they would mind. That's me personally. Other people would.
Well, the family wouldn't mind, but what about the patient that wants to that wants to go and it's illegal.
Yeah, like the Death with Dignity Act that's trying to be enacted. Like you've heard of that, right? It's to legalize the practice in California.
Then again, like I said, it really depends on the individual. So we have our own life, so it's our life, it's our life. And again, it goes back to
Do you feel like the government should have a say as to whether or not someone has the right to choose to
I
live?
don't think so. I think the person should step on choice. It's basically their own choice. But I'm not for it, but like I said again, it's their choice.
So, as far as the government goes, it is a person's choice, but there's another person involved. It's not. It's really not a private matter. It's public concern. There's doctors involved, and there's legal stipulations. So, don't you think that the government does have a right to have a say? Since it's not happening, it's not a private thing. There's a doctor.
I mean, I guess so. I guess so because the doctor can get in trouble as well. It's his word, it's his reputation as well. So I guess.
Thank you for your time, Fernando. I really appreciate it, man.
No problem.
You helped us out.
Thank you.